True or false? You must stop having periods before starting menopause hormone therapy.
False, because many women do start in perimenopause.
And number two, is menopause the same for all women globally?
Not at all.
One myth about estrogen that still frustrates you today.
Yeah, I think it's a very common myth that the estrogen is dangerous, is harmful, not to be taken.
What age should women start learning about perimenopause, menopause? Hi, everyone. Welcome to another episode of Hormones and Hope. This is your host, Dr. Chhaya. And today it's my privilege, greatest privilege, to interview a very, very special guest who is, I would say, coming all the way internationally to visit us, but it's virtual form. And here is Dr. Sunila Khandelwal. She's a seasoned gynecologist and international menopause expert residing in India and practicing in the city of Jaipur, as well as providing consultations globally. With decades of experience and tireless work in the field of women's health, she's pioneered menopause clinics, authored articles in journals and books, and also won several awards, both national and international, for her service. I've come to know her recently, and as soon as I learned about her passion, and I've just been in admiration about on her achievements and what she's done for women's health. So, welcome, Dr. Sunila, and we are very, very excited to have you with us today. Please share anything with our viewers because this is also being hosted on YouTube and our listeners for a podcast about what made you decide to pursue menopause care, community education in your field of medicine.
Hi, everyone, and thank you, Dr. Chaya. It's a proud privilege for me to be with you, and I must congratulate you for the initiative and the services you are providing in this particular field. And thanks for inviting me because it is all my passion. And on this platform, if I can help several women, I should say mature women, not the patient, not the menopausal women, I should say them mature women, those who are looking for improving their quality of life in second adulthood. Actually, Dr. Chaya, it was my passion and which started with my mother was my inspiration actually. When she was around in 40s, when I saw her drenching with perspiration, night sweats, rather she was having so much psychosomatic symptoms. That time I was in medical school and I was just finishing my medical school and I was doing post graduation. I was just wondering what happened to her, what is she passing through. She wasn't like that. So I thought, let me just dig into it. And after finishing my post graduation and just working abroad for so many years, and of course in India as a professor and had at medical colleges and medical supplement. It is something very unique to my journey that I took voluntary retirement from the government service and just devoted my time to this particular field to improve the quality of life. And this was the area where I wanted to do expertise. And for this purpose, I just visited Boston in 1997 and I met Professor Wolfutian. And he's father of menopause basically. And he was the first one to establish menopause clinic in way back 1967. So he was my inspiration, and I just shadowed many of the menopause clinics abroad, US and UK. And then when I returned, I just started my own clinic way back 1997 in India. So that was my journey. And since then, I just found the Indian Menopause Society, which is having more than 6,000 members working across the country in 57 cities. And we have credential menopausal practitioners also, like in America, you have NCMPs, right? So this is how my journey started. And after finishing my roles in different area in Indian Menopause Society, I just worked on international platform, and for last 20 years I'm at an international platform, and it is golden opportunity for me to learn from the international experts and also from my mature women group to whom I see day in and day out. So this is all my journey and my passion, turning transforming miserable lives into meaningful lives, because I do consider that these are not patients, they are mature women and they are looking forward to improve their second adulthood.
Yeah. I've never heard this before, but you beautifully pointed out, like even the phrase that you use, these are not patients, but mature women. That's very humbling. At the same time, it's very empowering because, patients, we feel that, oh, I have a disease or I'm suffering with something which is incurable or, it needs a lot of attention, but mature women and how you're taking care of them at that particular phase of life. Very beautiful. So, Dr. Sunila, we usually start with rapid fire just to debunk some myths or have a clarity on how we are going to enter into a deep dive questions. So either true or false, yes or no, or if you have one liner explanation. And if you feel like we need to go in depth in terms of one of the rapid fire questions, we can start with that in our deep dive. So here we go. Number one, true or false? You must stop having periods before starting menopause hormone therapy.
False, because many women do start in perimenopause.
And number two, is menopause the same for all women globally?
Not at all. It is, although it is a biological transition, but because of the different timings, age of onset of menopause, menopause symptom experiences, cultural sensitivity, socioeconomic status, the every woman is a different woman, and they suffer from this menopausal problems in a different way, looking to their ethnicities or maybe cultural differences, and definitely reason even. So not at all.
Thank you. Number three, one myth about estrogen that still frustrates you today.
Yeah, I think it's a very common myth that the estrogen is dangerous, is harmful, not to be taken. So that has to be removed because there is a proven strategies which shows that it has a major role in prevention of many long-term consequences and improving the immediate quality of life after the menopause or during menopausal transition.
Thank you. That's such an important answer. Number four, what age should women start learning about perimenopause, menopause?
I think as early as possible because when perimenopause starts to one year, 2 years before the actual menopause, and it lasts for maybe 4 5 years. So it is very important to start learning about knowing about the symptoms and started having the preventive strategies for coping of the menopausal transition. So as early as possible.
So, hot flashes is menopause. Is that really simple in terms of describing menopause?
No, I think it's a very complex problem, which is like this equation doesn't fit to all because hot flushes is just a single one puzzle from a larger, perspective because so many symptoms. So it is just one piece of the layer of the puzzle which we are facing.
So let's get into this in-depth answers because you talked about, debunking the myth of estrogen as well as, the symptoms of menopause. So can you walk us through the hormonal shifts in women in perimenopause to menopause and then post-menopause? So what is actually happening physiologically? What is the woman going through based on your experience?
There are hormonal shifts across the menopausal transition. First stage is like perimenopause. We have a estrogen staging system in place. And for Indian women, we have Ankylosaria, modified Ankylosaria staging system. Let me put for my Indian women, those who are one of maybe interested in knowing that. But by and large, we just start with perimenopause, which is a transition phase leading to menopause and often lasting for 4 to 5 years, right? And in this perimenopause, the estrogen become erratic. There are, the surges and dips are there. Breast tenderness develop, heavy or irregular periods do occur. Mood swings may happen. Some women, they suffer from migraine even, and the second is progesterone, which declines slowly and lead to the shorter cycles. Sleep disturbances are there. And of course, there is increased anxiety. But if you see biochemical markers like FSH and LH, so of course it rises because the ovaries become nearly less responsive. Second is like menopause, which occurs in Indian female. The average age is 46.2 years. which is 5 years earlier than the Western counterparts. So, we Indian females, we do suffer all these long term consequences, specifically NCDs, non communicable diseases, a decade earlier. So, that is very worrisome for Indian population. So, menopause, one must understand when there are 12 months no periods in consecutive months, then it is called as menopause. And again, in this, the same hot flushes and all those mood swings continues. But now the vaginal dryness, the urogenital system start affecting because of the no estrogen or low estrogen. And post-menopause is after menopause. And this is a long term till the end. I must say menopause and beyond when you talk about this. Here again, the estrogen and progesterone are low or stable. Symptoms may persist or evolve. The some women experience hot flushes, but now there is fully established genitourinary syndrome of menopause, which is like very much worrisome, and all cognitive changes to start, and joint pains, letharginess, exhaustion, all these symptoms they do occur. But these symptoms, they do vary because of genetic and epigenetic reasons, because of the lifestyle and health status, dietary exercise, stress levels, all these factors affect. In addition, psychosocial influences are there, like cultural attitudes, how much you have support system. In India, they have a positive attitude towards the menopause now. Before, it was culture of silence, there was taboos and stigmas, but now it is much better. So it depends on your psychosocial influences, lifestyle, diet, and genetic and epigenetic factors. This is how the hormonal shift happens, and one must realize whether she's in perimenopause, menopause, or postmenopause, and accordingly that preventive strategies or treatment, everything, actions should be taken right in time. Recently, when I attended the Asia Pacific Menopause Federation conference and I participated, and all South Asian countries, they showcase their status of menopause care. So I found overall in South Asian countries and Asian countries, I must say East Asian or South Asian, the age of menopause is less. But I found in India, we have this data of Indian Menopause Society, the national data, that is 46.2 years is the average age of menopause.
Wow. The perimenopause is close to 39, 40 years of age.
Absolutely, yeah, 40 years. By 40 years. And specifically, I must focus with the rising incidence of induced menopause, whether it is surgical because of the early hysterectomies or something, or frectomies, or maybe because of chemotherapy or radiotherapy. All these induced menopause, they are much, much earlier. They start as a premature menopause in women. And again, there is a point of worry of premature ovarian insufficiency, POI, which is very common now, and around 4 to 5% of the females, they do suffer. So it's not that you should really understand the perimenopause or menopause, but you should try to understand after 35 where you are. Are you getting regular periods? Not? Why not? What is the reason? Because premature, there is a very fine line between the premature menopause and premature ovarian insufficiency. Because the premature ovarian insufficiency, it is reversible, we can treat, we can give them hormone therapy till the natural age of menopause, so that we can prevent the long term consequences and improve their quality of life. In premature menopause, nothing can be done. It is just you have to start, preventive aspects and some treatment strategies. So one must understand, and in this era where there is the culture is to delay the fertility. Again, women should understand that, it is very, very important to have the right decision to complete your family if you are looking to it.
Yes, how much to think. Yes. Now, here I want to make sure we're not adding fear, we're not adding anxiety, but it's also closing the gaps of the knowledge so that, specialists like Dr. Sunila, again, are empowering women in this field of medicine, in this phase, like you said, the second phase of our lives. So, where do you see the biggest knowledge gaps, like in women's health? in terms of their understanding about menopause, its consequences, the multi organ effects, especially globally around in terms of the knowledge gaps?
Yeah, it's a very good question, Chaya. I must say the biggest global knowledge gaps in menopause care stems from the three interconnected areas. Number one, patient education. Second, physician or healthcare providers training. And third is societal stigma. So the gap persists across the culture and healthcare systems, but I think by 2025, I'm seeing recent there is change in turning point. But of course, in patient education, there is low symptom recognition. There is limited access to the trusted informations because women is still lag behind, and they rely more on the social medias and anecdotal advice, and there is lack of clear evidence based resources. They don't approach clearly. Either the access is poor or they don't want to go to the menopause specialist. They just, take you. I must say the Google University.
Yep. Now it's I heard Dr. Google and Dr. Chat GPT, but it's Google. You know what?
Absolutely. So, and second, which I am just focusing, I just realized that physician training or the healthcare providers, because only 7% of OBGYN specialists they are interested in menopause care, and a not and nearly 20% receive the formal training. But I'm glad that in India we are having, when I was president, I inducted a credential menopause practitioner exam, and that is giving in each area the menopause specialist to approach for. And the the skill tools are there, like guidelines are there, international menopause society recommendations are there. Even at we at the international menopause society, being as a board member, we are having the impart training program, and also the midlife health colloquium program. So I think we physicians, we healthcare providers should go and develop our skills. And the most important is societal stigma. There is culture of silence is still there, is workplace invisibility. There is a very rapid area to focus on is menopause and workplace. And 7th September, I must share, is the International Workplace and Menopause Day, which is being celebrated. Yeah. And it is created by EMS. I'm one of the member of the EMS also. So EMS is European Society of Andropause and Menopause. And we do celebrate World Menopause Day on 18th October, where we make the people aware the both. Every year, I am happy that we are bringing the posters and the leaflets for the women and posters for the women, and also a white paper released. And this time there will be release of lifestyle medicine. And another area is media. Media is very, very important in my journey, actually. I have found media is very supportive to me, publishing articles in newspaper, giving the health risk score, risk assessment tools, and all those things helpful. But it's still, there is negative connections which are being more popular and more, everything which is negative attracts more attention. So that is the reason. So we have to empower women by education. We have to increase providers training, and we have to change the policies of the workplace. And I'm happy recently I have gone to the NAMS website, because you're working in America. They are developing a next generation new program, an initiative by the Menopause Society. NAMS has a new name, the Menopause Society now. It is not North American Menopause Society. So they are aiming to train around 25,000 clinicians by 2028. This is the latest thing which I've seen. And also, I think because you're working in California, I found there was a California Assembly Bill 432, which requires menopause training for license renewal. So it's a wonderful, indicator that we are moving forward, and all the global organizations, the voices from the global organizations, they are helping out in this, making a bridge between the menopause care, between the women healthcare providers and the society and societal stigma. So I think it's a good sign. And no wonder in 2025, we might see that like in a school education, like in like puberty, we might have the classes or awareness for the menopause that will help the mothers and the sisters and all those who are suffering. And also, of course, the workplace policies will be in place, and there will be more menopause specialists available. Women will seek advice, and they have positive attitude towards the menopause. This is how I see in 2025, specifically when there is AI is developing. There are tools for the risk assessment, STA and FREX and everything is there. So we can assess the risk, and I think we can improve in a better way. We are in now in better position actually.
Yeah, this is so encouraging. Like you gave us everything about the international growth for the women. So just I wanted to ask you. So when we talked about the rapid fire, you actually debunked the myth that estrogen, what makes you frustrated in terms of people in general having this fear about estrogen being a bad medicine or not worth it. So can you elaborate on that? In terms of menopause hormone therapy, what's happening? Like, how is estrogen playing a big role for a woman where it's clinically indicated?
Actually, Dr. Chhaya, the clouds of doubt appeared after WHI 2002 trial, right? So, and later on, clarity was brought by so many other trials and everything that the right dose, right duration, right timing, and right route is very important for the safety, efficacy, and continuation and compliance of the therapy. So, every woman is different. We have to individualize. Estrogen therapy is not bad. It is very helpful in improving the quality of life, providing you have a cafeteria choice. You have to have a boutiquely made designs for each woman. Every woman is a different woman. The timing is very important. Like I said, if you are giving MHT for a premature menopause, yes, of course, you have to give for long duration. But if you are giving for a postmenopausal woman, you can have for 5 years, and then you can have the phasic prescriptions, which is the era of phasic prescription, where initially you can have MHT and then you can switch over for the bone protection, all these risoronate or bisphosphonates or all those drugs. And then we have so many armamentarium in our hand. But basically, the estrogen therapy for bone protection is proven. There are international guidelines. Genitourinary syndrome, local vaginal estrogen is very safe, and we must not prevent these women to improve their quality of life, to suffer day in and day out with the hot flushes. Because if we are using right dose and specifically the right duration, and because in my clinic, I have seen there is a core brain syndrome. It's like, the woman is suffering for hot flushes. She can't sleep in the night, so sleep difficulty. When she's not sleeping in the morning, she's depressed, she's lethargic. So she's just in the circle of this, which is a circle of this. So one has to come out from this. So if you treat hot flushes with the estrogen therapy, I think you are doing a great job for these women who might end up with later on. And there are so many trials and so many studies have come that hot flushes bring about depression, cognitive problems, and all those mental health is so deteriorated with that. So, for bone protection, for genitourinary syndrome of menopause, for cardiac health, but of course, you need to know in what dose she needs. The trend is ultra dose, short duration, and if she is suffering from medical problems, we can give her transdermally. That is much better.
Mm-hmm. Transdermal estrogen. So can you comment about progesterone? How do you use that in menopause hormone therapy?
In perimenopause, if you want, if she is having hot flushes and all, then you can give cyclical or sequential form. And if patient doesn't want periods and now she is approaching towards menopause, we can give combined form that is available. And I must say, my experience, that a progesterone is a major arm which is having a fear. One should fear the physicians, because We do have now dihydrogesterone, which is a better cardioprotective and better cardio friendly. So I think choosing the right progesterone is also important because WHI trials, it was the progesterone which was creating the problem. And secondly, they have given not to the right age. They have given after, in the later half. So that is also important. And so MHT is a boon, I must say, provided you individualize the risk and you identify the benefits, and you have to have a right patient and right dose.
Do you have anything that rings a bell? Any story of a woman who was probably hesitant or was not aware of availability of menopause hormone therapy, and then when you explained it to her or prescribed it to her, and the transformation that she witnessed? Anything that rings a bell?
There are so many women, but I think I remember it's still just you have bringing my memory. One of the doctor's wife was there. She came to me, and that doctor, he never realized that what she is suffering. The sad part of the story, being a doctor also, he could not realize. She came to my clinic and I saw her in a very bad shape. And I started hormone replacement therapy. And in India, we have Tibolon also, which is a gonoromimetic drug, which was very safe because she was having uterus. So I just wanted to give both estrogen and progesterone. And she has sexual difficulties. So their marital life was also very, compromised. And so I started that. And she is usually once we give the tibolon therapy, the schedule is that you have to have holidays also in between, right? Mm. But she found it so good. She started, and my schedule is usually after 1 month. I call my patients, my women, to menopausal women after 1 month, 3 months, 6 months, and then yearly, right? So she continued and she disappeared. I thought, I don't know what happened. She came after 3 years, and to my surprise, she was just happy and continuously she was taking. When she came, I was like, oh my God, you should have come for the checkups and all those things like mammograms and all those things. She came. I stopped for a while, and within 6 months, she came back. No, I can't stop. I need to continue. So these are the stories you learn from your own patients, whatever evidence based medicine you learn, but sometimes it is different from women to women. And we have to agree or maybe disagree, but we have to alarm these women. But there are women, those who disappear, who are compliant, especially the rural women in India, and those who are very happy and they want to continue.
So, what was the transformation like? Her symptoms before versus what symptoms like completely alleviated?
Yeah, I think the most important benefit what she got is from the hot flushes and also the sexual difficulties, improving in the sleep. And I think the genitourinary syndrome of menopause with vaginal dryness, which in turn leads to again sexual difficulties, was much better. But to these women, I add vaginal estrogens also, and I decrease the dose of estrogen. So there is a myth that you cannot give both. Yes, you can give. And if the symptoms are more locally, then vaginal estrogens are much more effective. So this is how you can improve their quality of life because there is loss of libido, but the sexual health can be maintained.
Yeah, that's beautiful. And I hope the spouse doctor ended up getting some education from you too. Do you have now? This was Tibulon, but any other stories where you've used estrogen, so systemic estrogen, with or without progesterone, based on if they had a uterus or not?
Yeah, because surgical menopause is very severe. The symptoms are sudden, they are much more severe, and the women suffer a lot. And suddenly she realized what is happening to me, both the physical component and the mental component. So I think the best form of menopausal therapy in these particular women is estrogen because they don't have uterus, it is safe. And these women, they suddenly improve their quality of life in terms of depression, cognition, hot flushes, and vaginal dryness and the mood symptoms, mood irritability, and all those things. So I found the surgical menopause or induced menopause, these women, they are much more better. They have much more better compliance because they are suffering a lot and they see a major difference in their life. So these are, and honestly, we also feel safe and we can convince them with full empathy and assurance because these women, they need attention, assurance, and assistance. I always say that these women, they need all these three things. And coming to us, if they are being taken care of, it's just, I feel very contented in doing this practice, definitely.
Yeah, absolutely. Absolutely. I usually tell if I have a guest, especially talking about perimenopause or menopause, is that the education or discussion or a conversation, dialogue, whatever you can hold on to with both the genders, the husband and the wife or the partners, is so important. And I do that with I'm almost 45 and, have these perimenopausal symptoms, but I have to explain it to my spouse. Oh, this anger is not me. It's the hormones.
Exactly. It's not she, it's her hormones, actually.
Yes, yeah. And you separate it, right? So then that also prevents clashes or conflicts because now you're dealing it with education, with knowledge. So I'm so glad that, you're providing that.
Yeah, and I always say that we need to empower them by encouraging them to just come out from their closet, right? They have to converse with the workplaces, their family friends, their mothers, their sisters, and all those who are around them, but not the behind the door small talks. So they should be open up, and I think the media should also portray a positive side of this, and the language really matters. As I said to you, mature women. Why should say menopausal women? It's a midlife because there is increase in life expectancy, and if the life expectancy is increasing, women is passing one third of her life after the menopause, right? So we can say second spring, or we can say wise women phrase, or midlife awakening. All these phases, it's the time of renewal, of strength, even rebirth, I must say. So, midlife, I will never call them as menopause. It's a midlife, right? Because increase in the life expectancy. And also, our slogan of Indian Menopause Society is fit at 50, strong at 60, and independent at 80.
Independent at 80. That is so important. Yes, that is so important.
So, this is the slogan of our Indian Menopause Society. And the most important thing that we must open the dialogue. For this, I have created a midlife women health questionnaire. So I just give them that questionnaire, and when they see that there are more than 30 symptoms are there, and the cluster of symptoms are there are 10 clusters, so mostly there are cluster of symptoms, and when they realize, yes, I do have this, yes, I do have, so you have to, you have to put forward the leading questions and just bring them out. But whatever said and done, we are discussing in menopausal therapy, I would still say there has to be a holistic approach for menopause care. I always say mind your mind, mind your body, mind your soul, mind your emotions, and mind your diet. So these are the things we have to provoke. And there is a definite science of therapeutic lifestyle medicine now, you know, in prevention of ABCD, that is adiposity based chronic diseases. All these NCDs, diabetes, osteoporosis, cancers, they can be prevented. But provided they are aware, women are aware, healthcare practitioner is, really very sensitive to their needs. And of course, society should take them positively. As you rightly said, the family should be supported.
Yeah, yeah. So beautiful. Yeah, I don't even have to ask you the last question because I wanted to ask you about the advice that you want to give us and the younger women. You summarized it so well. And the terminologies that you used, they were all positive reinforcement. The midlife, the wise women, right? Rather than thinking that I'm aging or
I always say you have to age gracefully. age is just a number. You have to age gracefully, right?
Absolutely, absolutely. Yes. Yeah, and someone coming to you as a gynecologist, I feel like you're living it, right? So you're like a living example of it. I'm pretty sure they're more inspired coming from their physician.
No, definitely. I must say that the women should be aware about what they are passing through as early as possible. And I always say it is well women screening. It is not a checkup. It's a well women screening. They are well, right? They are women, but they need screening after 40 because they need to know what is menopause, when it happened, what are the symptoms, watch for, what are the long term health problems like bone density, cognitive changes, cardiovascular decline, and all. And what are the treatment options available to them? They have to be aware. We have non MHT, non hormonal options also. We have therapeutic lifestyle changes also. We have complementary alternative therapy, although that C is not proven. But still, I think sitting in India and doing my practice and catering to my women at Indian population, I think the holistic care is very, very important. Mindfulness, yoga, meditation. So we physicians, we have to incorporate yoga in our clinical practice, I must say. So we have a bigger responsibility to give them right directives and remove their fears, anxieties, and apprehension, whether say perimenopause, menopause, and menopause beyond. And of course, if we are preventing right time treatment prevention, because this is the era we used to say prevention is better than cure, no, but now instead of prevention we talk about promotion of health. That is much more important, right? So I think we share a good responsibility, and as the midlife is like a new year, I always say to my patient, it offers opportunities to reinvent, recreate, and regenerate. The reproductive life is over, but not the productive life. One must understand.
My gosh, you're just showering us with positivities.
That's your platform, which brings so much positivity into me, even.
Yeah, no, this is beautiful. Say that again, the reproductive and the productive part of it. That's like a tag in front of it.
The reproductive life is over, but not the productive life. So one must understand, and we have to, develop new hobbies that I told you. And you have to take charge of your health, and you have to set the priority that you are at first now. You have to analyze yourself, increase your, whatever you could not do before. Now it's the time for you. You have done enough for the family and everybody. But now the time is yours. And I always say that we clinicians, we should give examples, positive examples of women, those who have done wonders after the menopause. And we have every country has those women. So giving the examples, having empathy, having sympathy, having positive approach towards, positive attitude towards menopause, and of course offering treatment options, whether hormonal or non-hormonal, and including holistic healthcare model into your clinical practice, that is a must actually.
Yes, yeah, each one of us. Absolutely, 100%. 100% with you. So, Dr. Sunila, as much as I've known you, I remember you'd mentioned that you also provide consultations or second opinion globally, or is it in Jaipur, in India?
Actually, I must say from the COVID times, it has really changed my practice, and I do provide across the globe. There are few patients from the Canada, Dubai, even US. So I do have online consultations. So I must say they can reach out through my website, drsunilakhandelwal.com, and also seek appointments on WhatsApp on the phone number mentioned there. And also they can enjoy and learn positivity towards the menopause by watching my YouTube videos, how one can transform their life. And the media is, as I told you, is very significantly played a role in my journey. So there are every 3 months there are like I go to the TV platforms and they just talk about menopause, like Menotalks and all those things. We do run menopause cafe also.
That is impressive. Yeah, I would love to meet you one of these days.
And I have in my booklet which I give to my patient that is stay healthy after 40. And this is in Hindi and English, both language, bilingual. So that is also bringing a major change in my clinical practice because it has all these risk assessment tools. Patient herself read this, bring this course, and they understand. Yes, they need my help. They need risk assessment, and there are positive menopause affirmations which I usually ask them to revise that menopause is a beautiful time. I feel liberated. All those affirmations. I'm calm and happy. I'm aging gracefully. I love who am I. I have a wonderful, energetic body. And thank you, God, for helping me to see the beauty in others and myself, right? So there are affirmations which I ask patients to just go through to release their stress and to have regain their self-esteem, I must say. So, but of course, the menopause specialist help is a must to come out from the midlife blues after risk score assessment, or as I said, well women screening. I think they can spend their rest of their life in a very, very positive way. एंड हिंदी में मैं यही बोलती हूँ कि मेनोपॉज़ एक वरदान है, अभिशाप नहीं है। शुरू कीजिए एक सफल, वैवाहिक, सुरक्षित, खुशनुमा जीवन मेनोपॉज़ के बाद। यह अंत नहीं है, शुरुआत है आपके जीवन। दैट इज़ हाउ आई एक्सप्लेन टू
Yeah, thank you. And this is just beautiful. I think we should just hold on to what you just said. Thank you. Thank you so much, Dr. Sunila. Looking forward to having you as be a guest again and share more tidbits on this topic and just this inspiration again.
No, thank you, Dr. Chhaya, giving me this opportunity. I'm totally like delighted to be here and looking forward to it. Thank you so much for giving me opportunity to talk to the global arena actually.
Yes, it's all our pleasure. Thank you.
And once again, congratulations for your initiative. I must appreciate, truly appreciate this.
Thank you. Thank you wholeheartedly.